Lovely to have you back with us once again. And this week we are starting off the programme once more with our CIT Marbella Guest of the Week. CIT Marbella is a business networking association, one of the most prominent along the Costa del Sol, and one of the great things they do for the members of the group is send them along to our programme once a week. And today we're welcoming Francisco Martinez. He is the medical director of Tiara Health, a fabulous health centre that opened up in the Golden Mile, and I'm delighted to welcome you to the programme, Francisco.
Thank you, Nicole. How are you?
I'm really well, and I went to the inauguration in the new shopping centre, well, not the shopping centre, in the
Oasis Business
the
Centre.
Oasis Business Centre, exactly, where the co-working spaces are, and a lot of great places there. I loved it. I love the concept, and I love that room that you can go into where you basically, they test your everything.
Yeah.
And it's something that I've had in my mind that I want to do one of those. What a great concept of the clinic. Explain a bit about it in general.
We have this concept that we want people before they get sick. We want people, not them to get sick. So this is really innovative because now in Spain, medicine is reactive. You have a problem, you go to the doctor. But why don't we go to the doctor to avoid these problems? So we live in a place, a very special place in the world, that it's such a paradise. We have safety, we have weather, we have good people, we have good food, we have many things, we have golf. And we want our people be playing golf and enjoying all the things that we do have in Marbella until they're 100, 105 years old, until they pass away. So we want them playing golf and enjoying life until the life ends.
So what kind of things can you prevent or alleviate by coming to your Tiara Health Centre?
When you will come to our center, we will make a very complete checkup to assess all the pillars of the aging. So we detect the weak points of the aging of every person. So every checkup is tailor-made, is customized for every patient, and we detect how the people is aging. So regarding to that, we plan what to do to enforce these points. For instance, if you have a problem with your cognitive system, we will enhance this, all the supplements and all the techniques to put your brain in place and to avoid the loss of neurons across the years. If your problem is the sarcopenia, which is the lack of muscle, I will introduce you my personal trainer, and I will put from the medical side all the things that will stop and reverse the aging on every side. So muscular, neurocognitive, and of course the reasons of death, the most common reasons of death are cancer, are cardiovascular disease. We make a preventive medicine. We put the things in place 20, 30 years before the diagnostic. So we are sure that people is aging well.
It really, the concept, I loved it, and I made a mental note that I should, particularly, I've got diabetes in my history in the family, and I was thinking, no, it would probably be advisable, because if you can get that there are indications that that may be something you can get, there obviously are nowadays, particularly lots of preventive measures, like even just getting a personal trainer.
Yeah, the personal trainer or nutritionist. In your case, you have this records in your family of diabetes. We will, of course, make a very complete blood test, but also we use wearables, we use devices to understand what's happening in your body. Let me give you an example. This is a device that is measuring 24/7 my blood pressure. It looks like a bracelet, fancy bracelet.
Yeah, very chic.
But I can show you my blood pressure 24/7. So these wearables is the same for sugar, the same for many things. So we have a control in our people. And also we can see, we can assess how are the treatments working live. So these things are not in the people's mind yet. But in the future, we will want to be forward to the disease. We will prevent the disease from the beginning, not when the disease is established.
You mentioned nutrition, and more, which seems silly because it's obvious, but we don't think about it, how important it is, what we eat, how we eat it, when we eat it.
And also tailor-made, meaning your nutrition advice is not going to be the same as mine, as everyone. So we personalize to the extreme everything that we do in the clinic. Thanks to our checkup, which is a very deep checkup, we will know what is your nutrition, what is your type of exercise that you need in every phase of our lives. Our needs are different, so we make a customization of every aspect of your life.
And what kind of treatments do you actually do in the clinic? Because if I remember, it was all very pretty and the colours were lovely, very nice ambience, but you actually had treatment rooms as well.
We do have IV drips to avoid lack of substances that you will need in your body and you even don't know that you need them. We have the hyperbaric chamber, which is a game changer for the health of our patients.
Is that the one with the oxygen?
Yeah, it's oxygen on a high pressure. There are a lot of chambers that offer oxygen. This is not a medical treatment. We offer oxygen on a high pressure, and this is a medical treatment that will help to heal the bones if you got operate or something. Will give you more physical performance for sure. After any treatment that can get you down, like chemo, radiotherapy, this treatment will push you up again. So the hyperbaric chamber is really nice. And also we have a neuromodulation, which is also an amazing treatment. When you have a craving for something, like craving for smoking, craving for food, our brain is making signals, electric signals, not very functional. So we put them in place again, thanks to this new device that we do have in Tiara. And also the hormonal replacement therapy, which is something really obvious like nutrition, but no one is doing it in Spain. So we brought this knowledge from the US, where everyone is under HRT, hormonal replacement therapy, but not in Europe. So everything mixed, combined and tailor-made for our patient is the key.
And where is the essence of Tiara Health? Who's the group? Where does it come from? How did they come to be in Marbella?
Well, I have a patient since 2010, so means 50 years ago. I met a patient and we were always discussing about how to improve the medical conditions and the patient conditions when you are in front of the doctor. We were not happy with the timing that we do have to attend our patients, and he as a patient was not happy with the attention that medical doctors were providing. So we started speaking, and 5 years ago we put the first stone, making the first document about Tiara, and we decided to do not only a clinic in Marbella. This is a project that will be spread all around the world. Soon I will come here and tell you that we will open in Saudi Arabia in the north. Lisbon and south of France will be our 3 next stages, but it's a project that will spread this concept of prevent the disease before it appears. So all around the world.
It makes so much sense. Many people are living to be older. The statistics in Spain show that there are like over 250,000 people over 65 years old just in the Costa del Sol. Yep. So it's obviously something that we need to look to age in a more healthy, happier way.
Absolutely. It does make sense to be 80, 85, 90 and not be able to enjoy life. We are in the place that we need to be able to enjoy life because we have many options to enjoy life. So I'm a golf player. I see myself playing golf with 95 years old and beating my grandson. So this is the point that we need to give the vision to the people that this is possible now.
I love it. I love the concept, and I'm at that age myself where it's like the moment to optimize. I think I would definitely now, seeing you again, come to the centre, do this first step, which is the one testing everything. Yeah. Because you look at everything, don't you? Bone and heart, and I mean just everything.
Everything depending on the patient.
Oh, okay.
We do have patients that they come to the clinic and say, please, I want to do everything. Okay, yeah, we can do that. But we try to customize even the checkups for every person. So we make a very complete blood test, a very deep blood test at the beginning with a very deep questionnaire with a lot of things. And then from that, I will speak to you, okay, this is the checkup, we want to do this because of that. Also, there is a point, I want my patients to be the professors of the groups, meaning when you will be my patient, then you will go to your group of people and you will be the professor of hormone replacement therapy, age management medicine, preventive medicine. So that is the point. And the patient feels involved in this project.
can understand it. You're talking in language that we can understand, giving the attention and time that everybody hopes to receive, because I think that's a lot of it now, even in private medicine, is no one having time, not getting answers, particularly in the Spanish system. They're very good at telling you what to do, but not why, not why they're doing it.
That's the point. Even in the private center, sometimes we don't have time. I used to work in other clinics that you come with your insurance, and it's the typical reactive medicine clinic. And we, honestly, doctors, sometimes we don't have time. I used to have 16, 20 people on the list, and I will attend that afternoon 35, 40. So it's a matter of time. So this is a project where time belongs to the patient, and we take the time that the patient needs.
I'm so delighted for you that you had the concept and then found the right people to put it into practice, that it is going so well.
Thank you very much.
And lovely to have you here on the program.
My pleasure.
As I say, I went to the place myself. I can honestly say, beautiful, no lo siguiente. It really is elegant, and now there's parking as well.
Yes,
in the Oasis Business Centre, because that used to be a problem, but there's a car park underneath as well.
Yep.
So it really is easy to park. If you haven't been for a while, don't worry in that respect. And get yourself an appointment at Tiara Health and check it out. That's what I'm going to do.
Be my guest.
I'll be there. This is not a threat. It's a promise.
Okay.
Thank you so much, Francisco.
Thanks to you, Nicole.